Hello, my name is Kevin Rath, and I am the co-founder and director of Manos Home Care. Buenas tardes a todos. And we serve 1,200 people with disabilities in their homes in Alameda and Contra Costa County. And I'm also a representative for the California Respite Association and the Letterman Coalition. We support the 10%. 2 days ago, Oakland minimum wage went from $12.25 and 9 days and it went to $12.25 and 9 days of sick leave. Manos serves over 300 clients in Oakland, and it will cost Manos Home Care $40,000 a month. We have not received a penny extra from the department yet, and we have not received a response saying that they're going to raise our rates at all. We face the impossible choice of shutting down services in Oakland or going broke, or maybe both. It's illegal to force the agency to bear the cost of government mandates for services that people that provide a public benefit. See Cunningham versus Superior Court. This must be remedied immediately. We hope that you will work with the mayor and the city council of Oakland who have expressed support for this. Here is a model that can change this, and I'd like you to consider it.
Thank you.
Hello, my name is Amelia Pepperday, and I'm an RN Area Director for California Mentor. I'm here today to speak on behalf of my DSP staff and nurses. I support 9 medical model programs in the community right now. Our clients are striving in the community. We have very intensive medical needs and excellent staff. My message today would be that these staff are increasingly having to work 2 and 3 jobs. A lot of our nurses are working a knock shift overnight, awake at another facility, and then having to come into our programs. I'm concerned about the health and safety of my staff as well as the clients that we serve. I do think that there is a successful model in the community to move people out of the developmental centers, but we have to look at this 10% increase because we need to be safe if we make this transition. Thank you.
Thank you.
Good afternoon. Thank you once again for giving this opportunity to speak. My name is Antonio Ranit. I'm chairman of URESCA, also known as United Residential Care here in Sacramento. We're 30 members small, and I'm representing all these 30 members who are not able to testify right now. We are dwindling in numbers. Everyone's lives matter. We all want to live in a dignified and decent manner in a society where all of us counts regardless of our abilities and inabilities. Our current state of affairs in our industry is in great need of life support as we have not gained much needed funding from the administration to restructure fair and equitable budget in our system. When our other industries were able to cope with the rate of inflation, our stagnant rates that was recently provided with an anemic infusion of 6% is far behind with the 3% inflationary increase. With all the new mandates and unstoppable increase in overhead expenditures, the collapse of our system and our small business is not far from reality. Residential care providers is dwindling in unprecedented numbers as we speak as a result of such inadequacy, leaving a short supply for client placement, and we need some help. Thank you for your leadership.
Thank you.
Will Stanford, Futures Explored, here to talk about Employment First, a policy adopted by California several years ago. Since we've adopted that policy, 700 people have lost their jobs. We have 700 fewer people employed in competitive integrated employment than we did when we started that, all because our support employment rates are the only rate cut that still exists at 10% from 2008. So at some point, if you want competitive integrated employment, you need to invest in it.
Thank you.
Maura McDonough from North Bay Regional Center. I want to give a shout out to the many components of what we call our system. We use that term pretty loosely, but for the folks that we support to be able to live integrated lives, it takes DDS, it takes the regional centers, it takes all of our providers, it takes the Department of Education, and it takes the Department of Rehabilitation. The Lanterman Coalition has very rightly urged us all to focus on the rate increase in the rate structures. I want to just broaden the picture a little bit and say that, you know, for the folks we support to be able to exercise their civil rights, and that is supposedly what we want to have happen. And I know that you folks know that. You're the choir. there are a whole lot more issues at stake and a whole lot more folks who are not only drowning, as you know, they're drowning now, but also simultaneously really struggling to improve quality at the same time. Thank you.
Thank you.
Hello, I'm Sunday Shields. Thank you for your time. I have Asperger's, and the people that serve us, going into helping us for the money is like going into the church to meet women. Also, I had to move 250 miles from my home, from where I was born, to get services. The services in the Central Valley are minimal, and that was before the cuts. Thank you for your attention. Bye.
Thank you, Ms. Shields.
Hello, my name is Victor Trujillo, and I work for a supported living agency, SAGE. And I work with some very dedicated people who love what they do. They love working with people in the community. And we ask that you consider this 10% increase so that we can retain these people who often have the difficult choice of continuing to do what they love or taking a job that they can afford to live on. Thank you.
Thank you.
Good afternoon. Matt Robinson with the California Association of Health Facilities. Part of our membership, we represent the intermediate care facilities for developmentally disabled, habilitative, and nursing throughout California. There's 1,200 of these facilities in California and about 7,000 residents. We're a member of the Latterman Coalition and completely supportive of their increase in the 15-16 budget. We're just asking you to also keep in mind these members. They are 100% Medi-Cal funded. They've had a rate freeze since 2008, 2009, and they also had that 2 to 3% cut. So we ask you also keep them in mind when you're moving forward. Thank you very much.
Thank you.
Good afternoon. Eric Stern, case manager of the Regional Center of the East Bay and chair of the SEIU California DD Council, representing about 4,000 workers in regional centers and vendor agencies. I noticed the governor's budget has some increases in compensation for the state workers at the DC, through a collective bargaining process, something very honorable. Every year that California doesn't increase funding to this community-based system, it degrades. And so we're asking for 10%, and we're asking for you, the committee, to collectively bargain, to represent this whole community-based system and 280,000 very, very important people in the state budget process. And we'll work with you any way we can. Thank you.
Good to see yet another colleague and neighbor. Thank you, Mrs. Stern.
My name is Sarah Wade, and I do support the 10% increase. And if I can just weigh in on the first issue, since I was kind of busy over there. Of all the people I've met that have come out of the developmental centers, none of them have had wonderful life experiences and stories that have been there. And this gentleman I live with and have lived with for the past 10 years. When he was in Napa State Hospital, he lost his vision because of circumstances in the hospital. Since he's been in the community, he has flourished, and he's doing amazing things. So please, please help those people that are there that don't know what it's like to be on the outside to get to see that light. Thank you.
Thank you.
Hi, I'm Doug Pascover with Imagine Supported Living, and hearing you used to be overnight support, Mr. Chair, I can hardly look you in the eye, but thank you. I wanted to support Marty's comments about the need for targeted relief. I'd like to applaud Mr. Kent's comments about the need for rational rates, and I just wanted to bring up the audit requirements that were added as part of the budget control several years ago, something you could do that's free that would help some of the agencies most at risk would be to repeal those. Agencies like mine would continue to do them. Thank you.
Thank you.
Let's get to this.
My name's Al Milan. I live here in Sacramento. This is my daughter, Molly. She's 23 years old. We were very fortunate. She was born in 91, and I feel like we've been in California for some of the best time of services. I went on to work in family support as executive director of Warm Line Family Resource Center here in Sacramento. I worked with CDE going all over the state in special education with focus groups with families. And what I see here today, I can't really offer much new other than to point out the obvious, that this is not just one slice of a population that we're talking about here in California. It's a community. It's people. And earlier I heard someone say everybody knows somebody. So this issue is not just about all these people over here. It reverberates out into the entire community. So I fully support the Lanterman Coalition request for 10%. I also I fully support looking at the rate structures and taking a good look at how to make the Lanterman Act work the way it was intended to. Thank you very much for your time.
Thank you.
David Mulvey with the SEIU Developmental Disabilities Council. I was also a service coordinator with Jim Shorter while he was at Tri-Counties Regional Center, so I appreciate the chair's challenges earlier today. I wanted to leave you with a little story about a direct service provider I was doing some training with. This was somebody who worked at a level 4 facility with people with severe behavioral challenges. And part of our training, we were asking people to describe their morning rituals as a way of getting them attuned to paying attention to the morning rituals of the people they support. And this person was really struggling with the exercise and took me aside and said, I can't really do this. You see, I live in my car. So I don't have any of those normal everyday things as a part of my routine. And that's not an uncommon situation for direct service providers who are working now at minimum wage with little or no benefits. This committee needs to take on the challenge of moving the standard for direct care professionals in California from minimum wage to a living wage. Thank you.
Thank you.
Hello, I'm back. Different issue. My name is Jackie Dillard-Foss, representing the California Supported Living Network, around 10,000 individuals in supported living and independent living across the state. And I was thinking about the D.C. task force, and as soon as those recommendations came, they came with dollars attached. And I watched with the community task force where there was recommendations and no dollars attached. So I wonder if the community was considered to be in decertification with the federal government, if we would get some money. That was kind of a curiosity for me, because we see money thrown at a decertified system, and this is a system on the brink, as you've seen from the ARCA report. The other thing I want to bring up very clearly is the salaried exempt positions is not my choice. It's in regulation. It's in the wage orders. So when you raise the minimum wage and you do not give me the funding to pay my salaried exempt employees, the wage that the state mandates me to pay, all that does is make a hole that already is deep, much deeper. So don't tell me it's a business decision. Understand my mandates as a business owner so I can keep my services stable for those I support. So one, we're a system in decertification, so please throw some money our way, and I would really appreciate it. 10% would be a good start. Thanks, bye.
Thank you. 2 days ago, we had a conversation with some advocates, and we suggested that we all start a campaign where we say, we all know someone, because we want to lift up stigma, because we want to open people's minds to understanding that we all know someone, whether we know it or not, directly or indirectly. And I'm thankful from the advocates who spoke today to hear that message is actually coming back to us. And I want to encourage the people in the room, the people listening, to continue to let that message reverberate in the community, so that everyone understands that, this is not about them, this is about us. Your struggle is my struggle, and my struggle is your struggle. So I want to encourage those who are here today to please take up the message of we all know someone as a way of helping to change the way people think about how we fund services for the people served by the great state of California. My colleague I think a question was sparked for her by one of the speakers. So, Ms. Grove.
Thank you, Mr. Chair. I got that question answered. right next to me. So thank you for your time.
Very good. Thank you to all the speakers. We're going to move on to issue 4. I'll ask Jim Knight and Brian Winfield to come forward, and Evelyn Abu Hassan and Rick Rollins to come forward, and Ms. Krasawani will continue on, and Finance, Ms. Welch. Let us move on, and I'll ask our presenters to please be ever so brief. We want to get on to the work that needs to be done, and we thank you for your brevity. Okay, we're ready to begin. Will that you? Okay.
Thank you, Mr. Chair.
Thank you, sir.
As the agenda correctly points out, the proposed governor's budget for the community services side includes an increase in current year of approximately $152 million. $102 million of that is general fund. That increase carries over into the 15-16 budget and includes an increase. The total increase related to the enacted budget is approximately $452 million. The increase is primarily driven by increases that we're seeing in caseload and service utilization as individuals, as was mentioned earlier, as individuals are moving out into the community from the developmental centers, costs for those services are increasing. We're seeing increased costs for supported living services and the other types of support that go along with moving people in the community, the higher cost of some of the homes that individuals are living in. So that's driving a significant portion of the increase. Approximately $309 million is what we're attributing to that. The budget also includes an increase of $44 million general fund related to Senate Bill 946. That's the legislation that provided behavioral health treatment be provided by insurance companies. So at the time that Senator Steinberg's bill was passed, the department was estimating savings of approximately $80 million. As the program has rolled out, we found that savings are significantly less, about half. So the budget includes an additional $44 million for that. Finally, there are funds included related to the Fair Labor Standards Act overtime rule, but as I'm sure the subcommittee is aware, the Department of Labor, this rule by the Department of Labor has been suspended by the U.S. District Court. So at this point, we've put out notification that we will not be funding overtime increases and are waiting further discussion by the federal government on this issue.
Thank you, Mr. Doyle. I mean, just so you know, on that last point, some on the committee have a slightly different view on that last point about IHSS, and we'll be taking that up at another time. Thank you. Ms. Abu Hassan, who is Senior Legislative Advocate at Disability Rights California.
Good afternoon, Chair and members. Thank you for the opportunity to speak with you today. My name is Evelyn Abu Hassan. I'm the Senior Legislative Advocate with Disability Rights California. Disability Rights California is a cross-disability organization. We represent people with all disabilities. Last year, we served about 22,000 individuals with disabilities. About half of those individuals are individuals with developmental disabilities. I did provide my comments in writing, so I'm going to try to keep my statement fairly brief within the 2-minute time frame and just highlight a few things. Disability Rights California believes that we need to strengthen the community system. We need to restore the cuts that were taken during the fiscal crisis and invest in new and innovative options for individuals with developmental disabilities. One of those innovative options is SB 468, which was authored by Senator Emerson, that allowed for the self-determination option for people with developmental disabilities. Essentially what that does is allow for an individual budget that a person with a developmental disability can control, where they can have flexibility in their purchase of services so that they can have the services that they need to live independently in the community. We think that that program needs to be implemented and move forward in a way that people from the community can use it effectively. Disability Rights California also believes that we need to expand community integrated options for people with disabilities by implementing the new home and community-based service regulations. We also need to implement the Workforce Innovation Opportunity Act, which allows for integrated opportunities in employment for people with developmental disabilities. It's critical that we eliminate sub-minimum wage and move forward toward integrated options and look at supported employment as an option for people with developmental disabilities and looking at those rates. I think Mr. Sanford talked a little bit about that. We need to implement employment first in every regional center for people with developmental disabilities as well. We need to ensure equal access to people with developmental disabilities in terms of services. In 2012, we passed trade liberal language which required the regional centers to look at disparity issues for people with developmental disabilities from underserved communities and diverse ethnic communities. What we found over time looking at that data is that people with developmental disabilities from diverse communities consistently get less services. We need to understand that, and we need to ensure that individuals are provided information in a language that they understand. SB 555, which was sponsored by Disability Rights California, reiterates the regional center obligation to ensure that kind of language access. We have seen that implemented somewhat inconsistently throughout. Finally, you've heard some client stories about people effectively moving into the community. That doesn't happen without appropriate community services and supports. We moved a young man, I'm going to call him, well, not young, but a gentleman named Eddie, from the regional center, from the developmental center. He lived there 40 years. We moved him in 2014. He's effectively living in the community. The developmental center staff had labeled him agoraphobic. He goes out into the community. He likes big box stores. He likes to travel in his community, and that's not possible without the appropriate community services and supports. And we need to really look at strengthening this system, because this system is our safety net for our community, and people are moving out into the community as they should be. Thank you.
Thank you, Ms. Abusan, and thank you for your work, and we look forward to your other examples like Eddie, so that we know how we can be helpful to those who you're also serving.
We're happy to provide those for you. I think they mentioned Joaquin earlier. We got him out of the developmental center, and now he's living effectively in San Diego in the community with his sister.
Thank you.
It's part of the work that we do. Thank you.
Mr. Rollins.
Chairman Thurman, members of the committee, and distinguished staff, my name is Rick Rollins. I'm here today as the legislative advisor to the Association of Regional Center Agencies, as well as a longtime parent advocate for the autism community. My 24-year-old son my 24-year-old son Russell has full syndrome autism. 19 years ago, I resigned my position as Secretary of the Senate, having worked in the State Senate for 21 years, in order to dedicate myself to the world of autism and helping people with developmental disabilities. And we've heard a lot of testimony today, and I'm not going to repeat all that's been said. I think folks much more eloquent than I am covered some very important points, and I think you all listened intently and understood what the message is. The system is in trouble. It's on the brink, and supporting the system moving forward is absolutely critical. I have been asked, though, to touch upon a couple specific areas in your agenda, including the implementation of Early Start. The initial steps towards rebuilding our system was spearheaded by this very subcommittee last year under the leadership of Assemblymember Dr. Shirley Weber and then private citizen Tony Thurman from Richmond. And we want to thank you, Mr. Chairman, for your intervention long before you were elected to this body, and I think it speaks volumes of your commitment to people with developmental disabilities. With the successful restoration of Early Start services for infants and toddlers at risk of developmental disability due to factors such as extreme prematurity, low birth weight, and developmental delays. Eligibility for this program was restored effective January 1st, 2015. That's just 9 weeks ago. The program really has been restarted just 9 weeks ago. It really is too early to gauge the number of new children that will be served, but important to note that early intervention makes a significant lifelong difference in the lives of these young children and their families. ARCA is excited to see the renewed growth in this program, and we will provide regular updates to this committee on the progress and return and implementation of Early Start. The next area you asked us to testify on is Shannon's Mountain. California's developmental services system must be nimble enough to meet a variety of needs in a variety of settings and must have the flexibility to support innovative programming. Over time, individuals, families, and now the federal government has asked for more integrated housing options. Land and housing are expensive in many areas of our state, so integrated housing options have been limited. One model program is the Harbor Village project. Harbor Village is a 564-unit mixed-use apartment complex developed over 30 years ago on the grounds and adjacent to Fairview Developmental Center. It's a cooperative public-private partnership between the state, Regional Center of Orange County, and the City of Costa Mesa and private developers. This program allows individuals with developmental disabilities to live in their own homes and actively participate in an integrated community alongside non-disabled neighbors. Based on Harbor Village's success in using developmental center land creatively for community living options and related services, a similar program at Fairview named Shannon's Mountain was approved by the Department of General Services back in 2008. Following years of delays of the project, in the year 2013, progress stopped altogether. Completion would create much-needed integrated housing options in a very expensive real estate market. We strongly urge all involved to move forward to complete Shannon's Mountain so that those consumers can take full advantage of that wonderful program. I have some other material here, and what we've submitted in writing in great detail to you. My good friend Tyrone has given me the card, and I'll respect that. Again, thank you so much for the hearing, and I'm very proud of our community for what they've done today. We had a wonderful rally outside on the Capitol steps, attended by over 400 people earlier today, and thank you.
Thank you. Congratulations on the rally, and thank you, all of you. Ms. Kasarwani, anything from the LAO's office?
Yes, thank you, Mr. Chair. Rashi Kasarwani with the Legislative Analyst's Office. I'll be commenting on the proposed augmentations related to increased utilization and the new federal labor regulations. In terms of the increased utilization, the department is projecting significant cost increases for general fund expenditures that do not draw down federal Medicaid matching funds. These expenditures are known as non-match general fund, and the increases are particularly the greatest for adult residential facilities under the community care facilities category and supported living services under the support services category. To give you a sense of the magnitude of this, the non-match general fund portion of support services expenditures is estimated to increase from $81 million for the 2014-15 enacted budget appropriation to $160 million for the 2015-16 proposal. This is an increase of $79 million general fund, or 97%. This significant growth deviates from the cost growth trend over recent fiscal years, particularly the last 3 years that we looked at. Thus far, the department has been unable to provide information on new factors that sufficiently explained the proposed increases for non-matched general fund expenditures in these two categories of community care facilities and support services. Our analysis also addresses the new federal labor regulations that require home care vendors to provide overtime compensation to their employees beginning January 1st, 2015. I'm sure you're aware that a federal district court has blocked these new regulations and that the department has therefore halted the commencement of vendor rate increases for overtime, which were appropriated at $11 million general fund in 2014-15 and $22 million general fund proposed for 2015-16. If the legislature is concerned that the department could spend some or all of the 2014-15 appropriation, then it would want to enact legislation specifically reverting these funds so that they would be available for any legislative priority. For the funding proposed for 2015-16, we recommend waiting until the May revision. We think we may know more about the status of an appeal filed by the Federal Department of Labor seeking to overturn the federal district court's decision and potentially uphold the federal labor regulations. Thank you.